Thank you for participating in the Texas Juvenile Justice Department's e-learning course. My name is Jessica Ford, and I will be narrating today's training on adolescent development and behavior. Before we begin, please ensure you have downloaded the participant guide, as we will refer to it throughout the course. This e-learning course is provided as an alternative to a live training presentation. The Juvenile Justice Training Academy does not guarantee that this option is in any way more or less suitable to prepare the trainee for the performance of their job duties. It is the sole responsibility of the employer to ensure that trainees are adequately prepared for the TJJD certification exam. Scenarios may be included, however, activities have been removed when interaction or engagement with others would be required. Scenarios, if used, are to evaluate comprehension of the material by the trainee and not intended to provide examples from the certification exam. Upon completion of viewing this e-course, the employer is responsible for completing any and all necessary documentation that the training on this mandatory topic was completed by the trainee. No certificate will be generated after viewing this e-course. Today, we will talk about juveniles and their typical adolescent behavior, how that behavior affects delinquency, and strategies you can use when working with them. When you think of a typical teenager, what words immediately come to mind? Some words that may have come to your mind might be lazy, moody, reckless, sleep, hungry, active, resilient, accepting, carefree, creative, adventurous, or attitude. Most typical teenagers are moving forward towards independence. They are often moody and challenge authority and frequently are emotional. Although most teens will try to meet reasonable expectations, they frequently irritate the adults that are around them, leaving those adults angry and upset. As juvenile justice professionals, we have to look past the behavior and understand the motivation behind teenage behavior in order to provide them with the help they need. Let's take a look at our objectives for the day. At the end of the course today, you should be able to identify typical developmental benchmarks juveniles experience during adolescence, examine how adolescent development influences behavior and delinquency, and outline strategies juvenile justice professionals can use to empower juveniles during these critical areas of development. Understanding the development of adolescents can provide important insight into why they do the things they do. This will not only help with supervision, but can lead to positive rapport and trust. Let's now take a moment to do a quick activity. Turn to the activity called Let's Reminisce in your participant guide and answer these questions. As we continue our discussion today, keep in mind the many emotions you felt as a teenager and the support, or lack of, you had. Now imagine experiencing those emotions and getting arrested and placed on probation. Juveniles in our system, in addition to experiencing typical adolescent benchmarks, likely will have experienced additional challenges like trauma, neglect, abuse, or environmental factors, which directly impact delinquency and development. Adverse childhood experiences, or ACEs, or traumatic events, are directly related to developmental delays and can contribute to a wide range of health risks later on in life. In the juvenile justice system, 90% of juveniles have experienced at least one ACE, with the average being 6. We must keep this in mind as we understand adolescent development and behavior occurring during that time. You will learn more about ACEs and their impact in the course, trauma-informed care, a focused approach. But for today, we will focus on various benchmarks adolescents experience, including physical development, social development, behavioral development, emotional development, and cognitive development. Let's begin with physical development. Physical changes that happen to typical teenagers can cause stress as their bodies begin to look less like a child's and more like an adult's. Puberty typically begins during early adolescence and involves the release of hormones that have been inactive during early childhood. There are 3 typical levels of adolescent growth, including early adolescence, which is ages 11 to 13, middle adolescence, ages 14 to 18, and late adolescence, ages 19 to 21. Regardless of the ages listed here, the actual age at which each level is reached is an individual process. Individual growth rates are due to an increase in hormones which trigger the development of either male or female physical characteristics, early or late in adolescence. Boys generally begin puberty between 9 and 15 years of age. The process usually begins 2 years later than girls and gives boys more of an adult male physical shape. During this time, boys typically develop the following: muscles, heart, and lungs enlarge dramatically, an increase in the number of red blood cells which cause the muscles to grow, testicles and scrotum grow, and penis begins to lengthen, nighttime secretions commonly known as wet dreams, dramatic growth in speed, strength, and endurance, height increases, and the voice changes. Chest, armpit, pubic, leg, and facial hair begin to grow. In general, girls begin puberty between ages 8 and 13. They typically begin the process 2 years earlier than boys. This transformation gives girls more of an adult woman's physical shape. During this time, girls are normally developing the following: fat deposit increase in hips, legs, and arms, breasts develop, the menstrual cycle or period begins, strength, speed, and endurance improve gradually and steadily, height increases, the voice changes, leg, armpit, and pubic hair begin to grow. There are some challenges associated with physical development. Let's talk about those now. Puberty is something we all go through. It is generally an awkward time for teenagers, and coupled with trying to fit in with peers, it can be highly uncomfortable for some. Behavioral problems can occur with boys and girls if they encounter puberty before or after other peers, often called early or late blooming. Let's explore what happens with boys who experience puberty either early or late. For early bloomers, they are often assumed to be more mentally and emotionally mature. They are assigned more leadership roles, valued by peers in sport activities because of increased strength and speed, clear, confident self-image, and more popular with peers. Of course, for an early bloomer, these advantages may be welcome, but with them can come some psychological disadvantages like depression, anxiety, or feelings of hostility. We have to remember that despite them developing early and their ability to excel in certain areas, boys who experience puberty early may not want to participate in certain activities, may not want to be a leader, and may feel undue pressure to do so. It is important to treat all children equitably, meaning they are provided what they need to be successful. This notion of equitability is discussed in depth in the mandatory course Cultural Competency, Module 1, Cultural Equity. So what about late bloomers? Late bloomers often experience self-consciousness or embarrassment because of underdevelopment and lower self-esteem than other peers. Low self-esteem may lead to depression and maladaptive behaviors such as substance abuse or eating disorders. It is important for these juveniles to be consistently reassured they are not less than their peers simply because of their size. Girls who are early bloomers are assumed to be mentally and emotionally more mature, often associate with an older crowd, begin dating earlier than peers, may be pressured into sexual experiences before they are ready, and may seem tall for their age early on, but stop growing before their peers. Some of these perceived advantages are not really that. Some of these may actually be dangerous for a young girl, particularly being pressured to participate in sexual activities before they are ready. Like boys, girls experiencing puberty late may also feel awkward around their peers, suffer from depression, anxiety, or eating disorders, may be teased, and may feel self-conscious and develop a poor body image. Why do you think juveniles' changing bodies affect their self-image? Physical changes, including things like body odor and acne, can cause a considerable amount of insecurity in juveniles. Some may even experience guilt, shame, and embarrassment because of the physical process their bodies go through. Because developing early or late could lead to maladaptive behavior, involvement in the juvenile justice system may occur. Juveniles involved in our system not only are coping with physical changes their bodies are going through, but also with the circumstances of their lives, which could be chaotic or lack supervision. We will talk about how adolescent development can impact delinquency a little later. Let's move on and discuss the second adolescent development benchmark, social development. Social development is the process of learning to interact with others. Due to hormones released during puberty, teenagers often experience a variety of mixed emotions, including feelings of moodiness, anger, depression, and sensitivity as they move through this time of change. As teens are developing socially, they are constructing peer relationships, including romantic partners, developing their self identity, which often includes exploring their culture, gender, and sexuality, which we will be exploring in the Gender and Sexuality, a Changing Perspective course, and they're also learning how they want to present themselves to the world. Being accepted during the teen years is very important. It is often the driving force in creating a sense of belonging and building self esteem. Creating a social identity may include building and maintaining friendships, recognizing ways in which they identify in regards to gender and sexuality, moving away from the safety of parents and making independent decisions, and attending various social events. These skills are particularly important because they will be used with every interaction juveniles have with each other throughout adulthood. Let's talk about what happens if a juvenile does not develop socially, does not have social skills, or is socially awkward. Being socially awkward typically is when a person doesn't fit in, has trouble talking to others, and becomes nervous or anxious in social situations. If this happens with juveniles, they could quickly fall into maladaptive behaviors, leading to isolation. With no friends to associate with, or if a juvenile identifies as lesbian, gay, bisexual, or transgender, or LGBT, being alone may be the only perceived option. Substance use. Depression, sadness, and isolation may lead to the use of substances to either self-medicate or escape reality. The next is truancy. It's often easier to avoid school because of bullying, low grades, or lack of peers. The next one is aggression. If a juvenile is being bullied, they may have to fight to protect themselves. Lack of connections can also lead to anger. Next is lack of trust or self-esteem. If a juvenile is mistrusting of everyone, often caused by trauma, it will be even harder to make social connections and feel good about themselves. The next is skewed view of images in the media. Television and movies often convey unrealistic relationships, violence, and inappropriate role models, which juveniles with a lack of social development could compare themselves to or cause them to create unhealthy relationships. Again, these harmful comparisons may lead to maladaptive behaviors. Let's move on and talk about behavioral development. With behavioral development, adolescents typically develop the following: the ability to relate to others, capacity to defer gratification, use of better judgment and decision making, and the ability to develop a realistic view of themselves. Adolescents also often establish these skills by taking risks, a natural part of puberty. Taking some risks is actually a good thing. It helps with growth and awareness. Healthy risk-taking behaviors may include pushing the body, such as contact sports, rock climbing, and skateboarding. Expanding the mind, for example, learning a new language, traveling abroad, or taking a challenging class. Also, nurturing the spirit, for example, volunteering, learning about a new lifestyle, or helping others. All of these examples have some element of risk, but they develop character and may help inspire others to take part in the same kind of activities. Juveniles involved in the juvenile justice system may not have access to options for healthy risk-taking and may choose risks which often end in arrest and subsequent supervision. When working with these juveniles, it is important to encourage them or teach them how to pursue appropriate risks and avoid the ones which could land them in more trouble. Dangerous risk-taking can include the following: addictions such as tobacco, alcohol, illegal drug use, or robo-tripping, which is abusing cough medicine; driving recklessly, at high speeds or under the influence; gang activity or illegal activity, and substance use; illegal activity such as vandalism or theft; physical altercations, fights, and robbery; running away; sexual promiscuity such as hookup culture, unprotected, and various forms of sex; social media, distressing images or content, bullying, harassment, and stalking; thrill seeking, for example, car surfing, choking game, playing in traffic, jumping from heights, and challenges. There are several reasons why juveniles decide to take these risks, including peer pressure, media such as television, movies, video games, glamorization of risk-taking, mental health disorders, low self-esteem, inadequate or absent role models, boredom or maybe excitement, rebelling, feeling invincible, substance use, and trauma. Let's move on and talk about emotional development in adolescence. During emotional development, juveniles are learning how to deal with stress and managing their emotions. As we said earlier, teenagers are often moody, feeling happy one minute and angry the next. Because social development is taking place simultaneously with emotional development, teens are often grappling with their self-identity and reconciling that with what they believe others think they should believe. As a result, their self-esteem can suffer because the two ideas may be different. Low self-esteem can often develop into feelings of depression, insecurity, unrealistic expectations, and excessive shyness. When supervising juveniles who may be suffering from low self-esteem, we can guide them in identifying and exploring their interest, talk with them about how to solve problems effectively, and encourage them when they are fearful of something like making new friends or breaking up with someone. Managing emotions is often known as developing emotional intelligence. This is how someone relates to others and how stress is dealt with. It's important juveniles learn how to be emotionally intelligent because it will provide future benefits, both in the workplace and in their personal lives. Some key skills when developing emotionally include recognizing and managing emotions. A juvenile must become aware of exactly what they are feeling and be able to articulate it. Doing that can provide adults with more opportunities to better help them in situations and offer options to deal with the problem. Failing to cope with emotions appropriately may lead to substance use, withdrawal, or depression. Developing empathy. Teaching empathy is important when communicating with others. Often teens don't know how to read other people's feelings, leading to miscommunication. Empathy can be taught by stressing how others have to cope with stressors, such as racial or gender identity discrimination. The next is learning to resolve conflict constructively. When dealing with conflict, juveniles need to learn how to articulate why they are upset and identify positive solutions to a problem. This last one is developing an appreciation for teamwork. The art of working with others is another skill juveniles will use well into adulthood. One person cannot do everything alone. Working with a team always produces a much better product, especially with very diverse viewpoints. Let's look at another adolescent benchmark, cognitive development. During adolescence, rapid connections occur in the brain, almost as if it's under construction. Let me show you a video about the teenage brain and misconceptions adults make about teens. Listen as Lacey Green explains why teens tend to act the way they do, and jot down anything she says that stands out to you.
You may become a legal adult when you're 18, but scientists say, 18? A grown-up? Yeah, right. Hey everyone, Lacey Green here for D News. Question, when does someone grow up? It's a philosophical question. It could have to do with the life experiences someone has and the wisdom they gain from those experiences. It's also a scientific question. Being a grown-up is related to how mature you are, or more specifically, how developed your brain is. For years, scientists have known that the human brain is not fully developed until around the age of 25. Although we have all of our gray matter, which includes cell bodies and neurons, nerve fibers, and support cells, by the time we're 12, it takes more than a decade for all that matter to become fully wired and pruned for efficiency. So this is a process called neuromaturation, and scientists believe it's the reason why teens in general, share some common behaviors. So I'm talking about things like sensation seeking, risk taking, and needing to be accepted by their peers. So the teenage brain is going through a lot of critical transformations, particularly in the prefrontal cortex, which is one of the last areas of the brain to fully mature. It's responsible for executive functions like goal setting, paying attention, motivation, planning, understanding consequences, and having self-control. So the fact that these functions are underdeveloped is part of why teenagers tend to engage in risky and impulsive behaviors like experimenting with drugs and alcohol, having unprotected sex, speeding, and doing stupid things that drive their parents a little cray-cray. Right around puberty, the brain's dopaminergic reward centers also become highly active and slowly wither out as you become an adult. This makes teenagers especially prone to peer pressure. The reward centers are super sensitive to social approval or disapproval. One study found that a 20-year-old was 50% more likely than a fully grown adult to do something risky risky if two peers were watching. Scientists have also found that brain circuitry responsible for emotional responses are changing, making teens more responsive to emotionally loaded situations than both children and adults. So teenagers might seem like they're being really dramatic with their emotions, but the reality is they're experiencing them very intensely. They're also experiencing a lot of feelings for the first time, which can exaggerate their intensity further. Intellectually speaking, the capacity to learn will never be as high as it is when you're a teenager, and their intellectual power and ability to do mental tasks is already right up there with adults. So I think there's a tendency for grown-ups to become impatient and dismiss teens as stupid, immature, and incapable, but it helps to remember that teens are undergoing a lot of neurodevelopment. It's all a part of the natural process where a human moves from dependence on caregivers to an independent, fully functional adult, which is obviously a really important time and, in my opinion, is well deserving of a little extra love and patience.
As you can see from the video, the brain is an impressive organ. It's responsible for all of our behaviors, interactions, and attitudes. During cognitive development, most juveniles are better able to think abstractly and are better at solving problems. Despite these achievements, adolescents are often misunderstood by adults simply because they time and again argue for the sake of arguing, jump to conclusions, are self-centered, think adults are wrong about everything, and are often overly dramatic. Because adults do jump to conclusions about challenging behavior, they may seek medical treatment for adolescents simply because they are at their wits' end. As juvenile justice professionals, it is essential for us to recognize certain behaviors in juveniles rather than jumping to conclusions, and refer juveniles for appropriate services. This may mean referring for a psychological evaluation or perhaps an evaluation for medication. In our field, medical professionals are often sought for their expertise with juveniles we work with. You will need to understand the different specialties available for juveniles, particularly in the areas of neurology, psychology, and psychiatry. Even if you do not work with these medical professionals specifically, a basic understanding is necessary when determining what services juveniles are receiving. What do you think the difference is between neurology, psychology, and psychiatry? Neurology is the study of the brain and nervous system. Neurologists treat stroke patients as well as patients with epilepsy, Parkinson's disease, and hundreds of other neurological issues. Psychology is the study of the mind and behaviors. Treatment comes from a behavioral approach, and psychologists provide counseling, therapy, coping skills, and tools for behavior modification. Psychiatry is the study of mental illnesses, from prevention to treatment, and comes from a biological approach. Psychiatrists provide medication to fill in the gaps for brain chemicals not being transmitted properly. Let's do a quick activity to further explain the differences between the three areas of study. In your participant guide, turn to the activity titled Name That Specialist. Decide which type of doctor the person would need to seek for treatment and fill in the blank with your answer. We will discuss the correct answers in just a moment. Number 1. Emily needs to see a psychologist. Number 2. David needs to see a psychiatrist. And number 3. John needs to see a neurologist. There are some specific parts of the brain which affect juvenile behavior. The prefrontal cortex, located in the front of the brain, is responsible for executive functions, such as judgment, planning, and strategizing. Typically, the cortex is rapidly changing until the mid-20s. The amygdala, located in the center of the brain, is key in the formation of emotional memory. So what does this information tell us about adolescent behavior, particularly juveniles we supervise? Because juveniles have more activity in the amygdala, or emotional center, they most often respond to situations using their emotions rather than their better judgment, directly impacting their decisions. You may be wondering how this information about cognitive development will impact how you supervise juveniles. Remember, these developmental benchmarks are necessary as juveniles transition to independence successfully. We now know, because of the brain and other factors, juveniles may not always make the best decisions. Let's look at specific ways these benchmarks and their subsequent behaviors may cause delinquency. All juveniles want to be treated like adults, but as we know, because of developmental differences, specifically with brain maturation, they often make decisions adults would never make. Immature and reckless behavior often leads juveniles straight to the juvenile justice system. Not all teenagers end up engaging in delinquent behavior, but the ones who do so because many of the following. Poor decision making. Juveniles often do not process information quickly, causing them to simply react when facing and making a choice. You often hear juveniles say the next thing they knew, they were participating in a crime, almost as if they couldn't believe what they did. Juveniles often don't think about the consequences of their actions. They just think of the here and now. The next is failing to think of the future. Juveniles often do not think about how things they do now will affect them later. Juveniles who have experienced trauma have an even more difficult time doing this. Because juveniles think of the here and now, they are often not scared of what will happen to them. Next is succumbing to peer pressure. Earlier, we talked about how important popularity and being liked is to a juvenile. If committing a crime, using drugs, or engaging in delinquent behavior such as gang activity will somehow make a juvenile cool, they will likely do it without a second thought. Dangerous risk-taking. We also talked about this earlier. Juveniles often engage in risky choices, failing to consider the ramifications and just wanting the thrill of their choice. The thought of driving fast, for example, is far more thrilling than thinking of the aftermath, like being in an accident or going to jail. Next is lack of self-control. During adolescence, juveniles are learning how to control themselves and their emotions. In addition, because of their increased hormone levels, they are often moody and irritable, which may increase the impulse to do something wild. The last one we'll talk about is lack of self-identity. Self-identity is a key benchmark during social adolescent development. If a juvenile has no idea who they are highly likely to engage in various behaviors, some of them risky, to figure that out. What are some other factors that could lead juveniles to delinquent behavior? While supervising juveniles, understanding adolescent development and behavior allows us to make decisions based not on just one crime, but on an individual juvenile's needs. We must always be mindful of whether we are recommending harsh consequences and whether the consequences are appropriate for the situation. We know all teens don't end up being arrested, but what keeps them out of trouble? It comes down to the environmental juveniles are raised in. Parental support, for example, greatly reduces the likelihood of a delinquent activity. Keeping juveniles busy with activities such as sports or other hobbies reduces idle time, which is a key factor in participating in illegal activity. The opposite can be said for juveniles living in a lower socioeconomic area or in poverty. Remember, the more ACEs a juvenile has endured, the higher the chance of the delinquent behavior and other mental or physical issues. Remember, juveniles in the juvenile justice system have experienced an average of 6 ACEs, and with the addition of adolescent benchmarks and their impact on behavior, their risk of delinquent behavior is significantly higher. Because of that, we have a duty to provide them with some supportive strategies they can use when they're in our care and when they re-enter the community. Let's discuss some of these strategies now. Although we cannot predict what juveniles have gone through in their lives, nor can we stop the anxiety caused by normal developmental changes, we can encourage them and empower them with positive coping skills. Promote resilience. When talking with juveniles, their strengths should be highlighted often and the resilience or the ability to recover in the face of adversity or trauma supported. When juveniles want to make changes in their lives, we can guide them with making the best decisions. Encourage relationships with positive and supportive family members and connections with the community. The more positive influence a juvenile has in their life, the less likely they are to become involved in delinquent behavior. Avoid adultism. Adultism is defined as behaviors and attitudes based on the assumptions adults know better than young people and are entitled to impose sanctions on them without their consent. As adults, we typically think we know better than children in all areas, simply because we are older. Juveniles often do not have a say in what happens to them because we as adults know best. Despite knowing what we do about adolescent development, teenagers are often thought of as immature, often are punished for their actions, and their opinions are, in many cases, not taken seriously. How many times have we told a juvenile they are being childish or they have an attitude problem? As juvenile justice professionals, we must be mindful of treating juveniles with respect and consider them in the decision-making process. Some tactics to avoid adultism include actively listen to juveniles without just judgment. This not only builds rapport but makes juveniles feel they are valued. Ask questions for clarification. Validate juveniles' feelings. And offer guidance and support, in part by providing accurate information. Encourage exercise or physical activity. Being active not only is important for maintaining a healthy weight and bone density, it also reduces levels of cortisol, which in high levels can cause health problems. Further, during adolescence, appearance and body image are highly important to juveniles, and exercise or involvement in sports activities may lower anxiety about body image. Sports activities also promote team building, confidence, and an opportunity to make new friends. Encourage juveniles to be active. Refer to sports programs, whether in the community or at school. If a juvenile is in a juvenile facility, physical activity is also necessary. In fact, the Texas Administrative Code, Chapter 343, mandates all facilities have a physical training program for juveniles. Juveniles should be encouraged to participate in these activities with exception to extreme weather conditions and medical exemptions. Juvenile supervision officers should be sure juveniles drink plenty of fluids during physical activity and be mindful of what to do in emergency situations such as a heat stroke, heat exhaustion, or dehydration. The next support strategy is to identify interests. When juveniles pursue things which are of interest to them, their self-esteem will improve. We can not only encourage juveniles to pursue these interests, but also provide resources they might not know about. Encourage juveniles to pursue their interest instead of spending all of their free time on social media. Often, juveniles spend much of their time on social media, which can become unhealthy if they have no other outlets. Being online all the time also lowers verbal communication skills needed throughout adulthood. Even when in juvenile detention or residential facility, juvenile supervision officers can talk with juveniles about their interest, encourage participation in team-building activities, and provide suggestions for activities when juveniles are released. Hearing a new idea from a person of respect may spark interest in a juvenile and lead to it being pursued upon release. This next strategy is to make appropriate referrals. When forming relationships with juveniles, we begin to determine what their needs are. If a juvenile is socially awkward, you can not only talk with him or her about how to navigate social situations, but you can refer the juvenile for counseling to work through those anxieties with a professional. It may be determined the juvenile needs medication. If a juvenile is in detention and you notice changes in behavior such as withdrawal, isolation, or extended sadness, make sure to document the juvenile's behavior and inform medical professionals immediately of the situation. This last support strategy we will discuss today is advocacy. We must be advocates for juveniles we work with, in part by partnering with all stakeholders involved with the child. For example, school is where juveniles spend much of their time. If they are having a hard time, whether with schoolwork, peers, or bullying, you should have a relationship with the school staff, such as the counselor, teachers, and administration to help reduce the school-related problems. The same can be said for counselors, child protective services workers, if applicable, coworkers, and families. For juveniles in detention, the same standards apply. Juvenile probation and supervision officers must be advocates for juveniles. This means contacting medical services if you notice something different with a juvenile, talking with teachers if a juvenile is struggling, or counselors to provide daily updates on a juvenile's mood. Remember, juveniles are experiencing many changes during adolescence, and even if they are in the juvenile justice system, they can still learn appropriate coping skills from supportive adults in their lives. Oftentimes, we may be the only people to encourage and empower juveniles. Treating them with respect and making decisions that are equitable or based on their needs is how we can help them with their transition to adulthood. When you leave here today, remember, adolescence is a time of rapid change, often the cause of impulsivity and flawed decision-making. Lack of maturation in the brain may lead juveniles to the juvenile justice system. And despite behavior caused by adolescent development, juveniles, along with a strong support system, can transition to adulthood with the ability to cope appropriately. Thank you for your participation in the Adolescent Development and Behavior course today.